5 most difficult NCLEX exam questions. Hey, future nurses, ready to put your skills to the test? Imagine yourself on the hospital floor, facing these real-world scenarios. Pause after each question to think about your answer. Let's dive in. Question 1. You're working in the cardiac unit when Mr. Johnson, a 68-year-old patient with congestive heart failure, tells you he's been feeling more tired lately and his legs seem swollen. You notice he's been on furosemide, Lasix, 40 milligrams orally daily for the past week. What's your priority assessment? A. Check his blood pressure. B. Assess his potassium level. C. Monitor his fluid intake. D. Evaluate his lung sounds. The correct answer is B. Assess his potassium level. Here's why. Furosemide is a loop diuretic that's great at reducing fluid buildup, but it's also a potassium thief. Low potassium can lead to dangerous heart rhythms, especially in cardiac patients. While the other options are important, checking that potassium level is your top priority to prevent potentially life-threatening arrhythmias. Question 2. You're in the clinic when Sarah, a newly diagnosed type 2 diabetic, comes in for a follow-up. She's been prescribed metformin and looks nervous. "Nurse," she says, "I heard diabetes meds can make you gain weight, and I'm worried about injections." What's your best response? A. Don't worry, you'll get used to the injections quickly. B. Let's set up a regular schedule for your blood glucose checks. C. Metformin actually might help you lose a little weight. D. You'll need to come in weekly for us to administer the medication. The correct answer is B. Let's set up a regular schedule for your blood glucose checks. Here's the scoop. Metformin is an oral medication, so no injections needed. Phew. It often doesn't cause weight gain and might even help with weight loss. The key is regular blood glucose monitoring to ensure the medication is doing its job. By focusing on this, you're addressing Sarah's underlying concerns about managing her new condition effectively. Question 3. You're working the night shift when Mr. Garcia, who's on warfarin for atrial fibrillation, asks for a late-night snack. The kitchen sends up a tray with a turkey sandwich, carrot sticks, and a large side salad packed with spinach. What's your next move? A. Serve the meal as is. It looks healthy. B. Remove the spinach salad and explain why. C. Call the doctor to adjust tomorrow's warfarin dose. D. Tell Mr. Garcia to avoid all green vegetables from now on. The correct answer is B. Remove the spinach salad and explain why. Here's the deal. Spinach is like kryptonite for warfarin. It's packed with vitamin K, which can counteract the medication's blood-thinning effects. We don't want Mr. Garcia to avoid all greens forever, but a sudden spinach binge could throw his carefully balanced INR out of whack. It's a perfect opportunity to explain the importance of consistent vitamin K intake while on warfarin. Question 4. You're in the ER when Tina, a 22-year-old asthmatic, is rushed in wheezing and struggling to speak. Her roommate mentions she ran out of her everyday inhaler last week. Tina's oxygen saturation is 89%. What's your first medication move? A. Grab an inhaled corticosteroid. B. Reach for the albuterol inhaler. C. Prepare an oral antihistamine. D. Set up a nebulizer with a long-acting beta agonist. The correct answer is B. Reach for the albuterol inhaler. Here's why it's a breath of fresh air. In an acute asthma attack, a short-acting beta-2 agonist like albuterol is your go-to superhero. It works fast to open up those airways and get Tina breathing easier. The everyday inhaler she ran out of was likely a corticosteroid for long-term control, but right now, we need rapid relief. After she's stable, we can discuss the importance of keeping up with her maintenance meds. Question 5. You're reviewing lab results for Mrs. Lee, a 59-year-old hypertensive patient who started lisinopril 2 weeks ago. Her potassium level has jumped from 3.8 to 5.3 MEQL. She mentions feeling some muscle weakness. What's your primary concern? A. She's developing hyperkalemia. B. She's experiencing hypercalcemia. C. She's at risk for hyponatremia. D. She's showing signs of hyperglycemia. The correct answer is A. She's developing hyperkalemia. Let's break it down. Lisinopril, an ACE inhibitor, is great for blood pressure but can turn the body into a potassium hoarder. That jump in potassium levels, combined with muscle weakness, is waving a red flag for hyperkalemia. This is crucial to catch early because if that potassium keeps climbing, it could lead to some serious heart rhythm problems. Time to alert the doctor and consider adjusting Mrs. Lee's meds. How'd you do? Remember, the NCLEX isn't just about memorizing facts, it's about applying your knowledge to real-life situations. Keep practicing, and you'll be ready to tackle anything nursing throws your way. Follow for more.